Um, Another thing I certainly want to encourage all of you is to eat a healthy diet. Plenty of rest and exercise really helps the body and the immune system to fight disease. And a word of caution if you're taking care of children with viral illnesses, please do not give them aspirin products, as there may be, because there is an association with aspirin products and Reich syndrome. Again, CDC recommends sick children staying home from school until they're fever-free for 24 hours without taking fever-reducing medication. Adults should follow the same guidance as well. And again, as stated earlier, our website, I will repeat that again at www.odh.ohio.gov, will be available 8 a.m. to 5 p.m. with a wealth of information. Finally, I know there is a lot of concern about the safety of the vaccine. I want to assure you that H1N1 vaccine was developed with the same high standards of quality and safety as other seasonal flu vaccine. Therefore, I want to encourage everyone to get a seasonal flu shot, if recommended, through your physician. And also, I want to encourage everyone, if recommended through your clinician, to get the H1N1 vaccination. Why is that so important? Vaccination is the best tool that we have to prevent flu. In Ohio, 37% of our population typically get a seasonal flu shot. And within that number, only 24% of the people 18 to 49 years of age get vaccinated, whereas 70% of adults 65 years and older get the flu shot. So there is a concern about our youth and our college-age students, and we want to encourage them this year to get the seasonal flu shot as well as H1N1. And as we at the Ohio Department of Health work to safeguard the health of the public during this pandemic, we are also mindful of the negative economic impact widespread sickness could have on our state. That's why it is so extremely important to protect our health so that we're equally armed to protect our economic well-being. Thank you so much, and at this time I will introduce the Health Commissioner from Hamilton County, Mr. Tim Ingram.
Thank you, Dr. Jackson. I'd like to first of all recognize the Governor's leadership and Dr. Jackson's leadership in assisting local public health departments on this important endeavor of vaccinating our populations throughout the state for H1N1 influenza. Your local public health department is working very hard to assure that our citizens and their communities they work, live, and play in are protected from H1 influenza by vaccinations and timely, accurate health messages. Many partners are working with us. Of course, the Ohio Department of Health and the leadership at the Ohio Department of Health has been very valuable into assuring that local public health departments and our partners have the resources necessary to carry out a successful campaign. We're working very closely with our school districts, our Ohio Department of Education, our parochial schools, our private schools, and of course our public schools, our colleges and our universities. As you just heard, Governor Strickland just signed an emergency order. We're very thankful to the Governor for allowing us to be able to utilize the fine services of our emergency medical corps, our EMTs, that many work closely with our fire departments throughout the state. This will allow local public health to utilize those personnel as community vaccinators. Of course, our physicians, our nurses, and the many associations that they make up our hospitals and our federally qualified health centers. Together, we are working together to vaccinate the 5 priority groups. This is what local public health departments do. We work every day to prevent infectious disease from spreading in your community. By vaccinating people in the highest risk groups for the most, have the highest probability of getting the most serious disease from H1N1 first, and then others, we will build herd immunity to H1N1 influenza. And this particular strain that's caused this pandemic, we will put it in the history books for good. With your help and working with our partners, we will be successful.